and or sperm. The word comes from the ancient Greek hypo, meaning below or under, gonad, meaning seed or offspring, and ism, which is used to denote a condition. Rates of hypogonadism vary depending on measurement criteria, affecting anywhere between 3 and 38% of men. Primary hypogonadism, defined as testicular dysfunction, i.e. not making enough cookie dough, is rather rare, affecting fewer than 1% of males. Secondary hypogonadism, which occurs when the hormone systems are dysfunctional, i.e. baking too many cookies, is much more common. Hypogonadism rates increase with age and weight, with higher risks for males around middle age and older, and those with a BMI above 30. Testosterone is an androgen, a, quote, male sex hormone. Hormones are signaling molecules, and androgens signal in a crucial way. Testosterone and other androgens promote the creation of specific, quote, male proteins. Fun fact, you may have heard of anabolic steroids. The word anabolic refers to things that increase the production of proteins, and many anabolic steroids mimic testosterone. These proteins are what create the male anatomy, promote libido, and help define metabolic rate. When testosterone is low, such as with hypogonadism, symptoms occur which relate directly to the loss of testosterone function, i.e. reduced libido, erectile dysfunction, fatigue, low fertility, loss of muscle mass, insulin resistance, and obesity. So what's actually happening inside the body with hypogonadism? Well, there are myriad possible causes, but one possible culprit for sufferers, especially overweight sufferers, is an enzyme called aromatase. Aromatase is a protein enzyme that converts testosterone into estradiol, also called E2. Estradiol is an estrogen and is the critical sex hormone for females during the reproductive years. Females produce androgens like testosterone, but at a much lower concentration. Aromatase acts as the cookie baker and mediates the conversion and balance of male and female sex hormones. Much like a baker, aromatase, quote, makes more cookies in response to age, obesity, alcohol use, and some hormones. When aromatase increases, the balance of hormones shifts from cookie dough to cookies, from testosterone to estradiol, and from androgens to estrogens. Obesity increases aromatase activity, contributes to low testosterone levels, and is commonly associated with hypogonadism. So it makes sense that weight loss is a primary treatment goal for overweight individuals with low testosterone. This is bad news for me and my love of cookies, although studies find that as little as 5% weight loss can improve testosterone levels. Beyond weight loss, the typical treatment for many men with hypogonadism is testosterone replacement therapy, or TRT. Testosterone may be delivered by nasal or skin gel, patches, oral pills, or injections. TRT comes with a host of relatively mild side effects, including hair loss, acne, skin changes, headache, nausea, and vomiting. More serious adverse effects can also occur, including polycythemia, a blood disorder of abnormally high concentration of red blood cells, which should be monitored by a healthcare professional. One potentially major side effect of TRT is an increase in the chances of infertility, making this a poor option for some men. Clinical trials are currently underway looking at different pathways to increase testosterone, including aromatase inhibition. In early results, inhibiting aromatase in overweight males led to rapid normalization of testosterone levels and increases in motile sperm count, which may help with fertility issues for some men. These studies also found side effects, including headache and increased red blood cells, blood pressure, and prostate-specific antigen, or PSA. Aromatase inhibition still needs more long-term evidence, but if these clinical trials are successful, clinicians may bake up a new way to treat low testosterone, and that's pretty sweet. Thanks for joining us on this week's episode of Med Evidence Articles. If you'd like to know more, all of our sources are linked in the podcast description. You can also visit our website at medevidence.com and Check out the Med Evidence podcast for discussions between physicians and subject matter experts. Med Evidence provides evidence-based information that empowers individuals to make informed health decisions. The organization stands apart in the presentation of unbiased clinical research in clear, accessible formats guided by medical experts. Med Evidence provides education for patients and healthcare professionals with a focus on research as a care option. Note that information provided in this podcast is for general educational, scientific, and informational purposes only and is not intended as and should not be treated as medical or other professional advice for any particular individual or individuals. If you are experiencing any medical issue or have any medical concerns, you should consult with a doctor or other medical professional. My name is Benton, and we'll catch you next week.